Scientists in Cambridge finished the planet's greatest gene expression sequence draft in health, that brings expect of superior insight of diseases and more rapid diagnostic. Human beings in uncommon diseases, their household members and carcinoma patients took portion. 1 in 4 persons attending in uncommon diseases acquired a diagnostic for the at first period. Before currently, parents of family in uncommon gene facility characteristically consumable year hard to discover out the reason. The 100,000 genomes draft has ended the diagnostics odyssey for lot families, and in several cases, led to efficient treatments. Hannah Youthful's child Tilly, elderly 6, who has a disturbance that causes detained growth and seizures, had her genome sequenced, in both of her parents. In January 2018 she was undiagnosed in GAMT deficit, a curable metabolism disturbance, that is inflicted by an legacy gene mistake. She lose the capacity to go and was possessing hundreds of seizures a date. With Tilly has been on treat, Hannah says the distinction is wonderful. She is connected, complete of lifetime, her seizure is lost and she is no much longer forcible, her mum says. Tilly is yet strongly mental incapable, but she is so lot superior rather than she would include been out of the diagnostic. Had Tilly's disease been identified over, several length-term harm could include been prevented. In all, 85,000 human beings had their whole gene coding, or genome, sequenced, but since carcinoma patients as well had their tumor DNA displayed, the quantity of genomes totaled 100,000. The humane genome is done up of billions of trimming of DNA, found in almost each cage in the flesh. It is the manual guide for lifetime and errors can flop a extensive band of disorders. Carcinoma and uncommon diseases were selected for the draft since both of are firmly related to changes in DNA. Carcinoma is caused by mutations in genes, the most of uncommon diseases are as well inflicted by errors in our genome. Karen Wagoner, 46, is amongst 15,000 carcinoma patients who had the DNA of their carcinoma tumor sequenced, as the genome they legacy of their parents. She has had chest carcinoma and malignant melanoma, but scans propose she is precise of the illness. On part of carcinoma patients sequenced as portion of the draft were later capable to get portion in a clinic test or get a AIM treat. The job has been overseen by Genomic England, that was set up in 2013 particularly to supply the 100,000 genomes draft. Though the sequence has been finished, the analyse of the genomes, by researchers through the UK, is ongoing and several attending are yet waiting results. There are now aspiring plans to succession 1 millionth genomes in the UK in the following 5 years, as gene test becomes more than embedded in NHS thoroughness. Professor Mark Caulfield, head scholar at Genomic England told, the sequence of 100,000 entire genomes symbolism an emergency UK accomplishment. How is transformation the annex of genomic in our NHS? The expect is how it will conduct to more than fast diagnostic, superior preventive of disease and more than AIM medication. Sir John Chisholm, armchair of Genomic England, told, your public health recording will ultimately include a genome spine to it, how will allow which is event to you to be compared in which yours genome is expressive yours physician, and thus a more than exact diagnostic or treat will be accessible. While the at first humane genome was completely sequenced in 2003, it had undertaken 13-year and price £2 bn present, a genome's cost of DNA can be sequenced in just 30 protocol, at a price of £600. The successful of the 100,000 genomes draft underlines the UK's stance as a planet lead in the box.